topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon from the East Coast all the way down to the great state of Florida. This is the Ask the Expert show, where for the last 16 years, we've been bringing you top experts in the field of legal, health, financial, and home improvement. Hey, I'm going to take a few extra minutes on my opening because our expert today, we're going to be talking about Medicare. And my father, God rest his soul, he told me, if you ever want to be successful in business, you got to go the extra mile. And I said, but what does that mean? You have to go the extra mile. He said, look and do the small things. The small things add up. And I call it my care package. I got a package from Stephen Fromm, our expert today, and it was loaded with promotional material, including the book that he wrote. In fact, here is the book right here. Hope you can see it okay. Medicare Breakdown. And I looked through this package. Folks, there's everything from a pill dispenser to, this is one of the bags I got. I'm just dropping things all over the place. But what I'm trying to say is Stephen went to all this trouble, and it is so amazing. These are all promotional items with his name and phone number on there. And there's so many things that you can use on a daily basis. And I got to tell you, I had this feeling about Stephen after our first show, and we did something we normally do not do. For 16 years, we usually, each expert has their own state. But I needed somebody for Florida. And instead of looking for someone in Florida, I found Stephen, who also represents clients in Florida and all the states on the eastern part of the United States. Let me welcome you to, I'm like in awe of this man, Stephen Fromm.
Hey, good afternoon, Steve. Thanks again for having me on the show. Thank you very much for your kind words. We appreciate it. But I will say that Judith is the one who puts that package together. I come up with the ideas, and I just give it to her, and she runs with it, just like the sweatshirt, everything. She's very creative. So it's a team effort, very much a team effort for everything.
It's so amazing, though, the extra mile, because we have other experts around the country, but what you've done here, Stephen, and gone the extra mile, what that means is what I learned when I had my first, we've talked about it on the show, when I had my first agent. And by the way, and I mentioned it on one of our shows, I don't know if Stephen remembers, starting next year, he is my Medicare agent. And hey, I'm expecting some great things out of you, bro. But you just remind me, because we're going to be going through you next year. That's how much I trust you. And I got to tell you, folks, because I had an agent who I thought I trusted, who was the laziest son of a gun. And just because, Stephen, you represent a lot of companies, correct?
Over 25 different companies, yes. Mm-hmm.
So you're not going to just give somebody one plan.
That's correct. That's why we do our in-depth client needs analysis to understand what their healthcare needs are and what is going to work better for them, be it original Medicare or a Medicare Advantage plan. And that's the time we take to really, understand our clients. And like I said, as I always stress, make a positive difference in their life. And I'm not just helping you today, but I'm looking to plan for the future as well.
Well, what I'm trying to paint for you is, I don't care if you have an agent or not. I mean, I'm getting rid of mine after hooking up with Stephen. But I'm telling you, your agent is so important, and things are really changing. Stephen, I keep hearing that Medicare Advantage might even be changing a lot next year.
It's very fluent, Steve. Medicare Advantage plans are, as we talk about on the show a lot, constantly changing. And right now, again, is the OEP, the open election period, where someone who is in a Medicare Advantage plan can still make a change. They may not have liked the plan that they chose in the beginning of the year during AEP, and now they want to change their plan. They still have time to do that. Or maybe they're not, happy with Medicare Advantage plan or thinking about going back to original Medicare. So those are some of the conversations we're having with a lot of seniors right now.
What are some of the main questions your seniors are asking you now?
Well, that's a great question. And I'm going to turn it around in the sense of saying one of the things that we're doing is educating, telling seniors and families we work with respect to, yes, Medicare is very comprehensive. However, there are a lot of different exposure issues that are out there that you may not be aware of, and you could incur a lot of out-of-pocket costs. For example, we've mentioned previously with cancer insurance, there's a lot of things that Medicare does not cover with respect to medical stuff for cancer, as well as some of the non-medical costs that could lead up to a large dollar amount for someone, as well as someone has to go to skilled nursing. There could be some out-of-pocket costs for that. Are you aware of that? And these are things that we've found out that a lot of agents didn't take the time to really just go deep with their client and help them understand that, hey, not just here to help you get your health insurance, but we want to create an umbrella. We want to protect you against exposures as well. And finding that that's really making a positive difference with families. They're really resonating and saying, wow, I didn't know that. And that's really building our relationship with these families.
Speaking of not knowing that, what is umbrella coverage?
Great question. That is a great question. And that is really what we're doing these days, is talking about umbrella coverage. It's raining here in New Jersey. So I would say if you're going to go in the rain, you're going to bring an umbrella to protect yourself so you don't get wet. Well, umbrella coverage is something that we discuss with every senior, be it original Medicare or Medicare Advantage plan. When we talk about umbrella coverage, we're talking about additional health insurance coverage for you to reduce those exposures. So for example, with original Medicare, a lot of seniors are not aware that, dental, vision, hearing is not offered. So we have a conversation regarding, hey, you know what? You need to enroll in a dental, vision, or hearing plan. We'll go back to the cancer insurance. Have you been exposed or a family gone through cancer? I'm sure you know what that's like. It's a very difficult experience. We talk about that. Again, the skilled nursing part of it, as well as you're in a Medicare Advantage plan. We saw a lot of hospital insurance. You might be in a zero premium Medicare Advantage plan, but you have co-payments, you have co-insurance, you have hospital stays. All that could equal out-of-pocket expenditures. There are out-of-pocket maximums for those plans. Say, like, I'll use a round number, say $10,000. And the question I will say to somebody when they're in a Medicare Advantage plan, how would that affect your budget? If you incurred $10,000 out of pocket, and let's just say it was for cancer, for example, and you incurred $10,000 on January 1st, December, and then come January the following year, you hit your out-of-pocket max again. So with a span of 2 months, you $20,000. How would that impact your budget? So that's why with the Medicare Advantage plan, we always sell the hospital umbrella insurance. We want to make sure that someone is protected. because those are some significant dollar amounts. And, again, not having someone to really educate and clarify. That's what we do. Educate, clarify, making sure they understand, wow, I wasn't aware of this. A lot of people, as you know, get a Medicare Advantage, which is zero premium plan. I'm going to have zero cost. That's not the case. It's just the opposite. So again, education is our key. Education.
Well, I'm going to, I guess, pull out of the bag some of the questions that I had in the beginning, because I have learned now there's a lot of people who do not understand about Medicare, except for the national commercials they see on TV. But so let's talk Medicare. What happens after someone has surgery or a hospital stay? Does Medicare fully cover recovery and skilled nursing?
That's a great question. Well, first of all, there are some parameters that talks about Medicare that you have to have a 3-day hospital stay to go to skilled nursing. And a lot of people don't realize that. It has to be that 3-day inpatient hospital stay. And then there has to be something regarding, continuum of care. Are you improving so you can stay? Because people don't realize that Medicare they will call the skilled nursing and ask, hey, is Steve improving? If not, then we're going to have to discharge him. Okay. And maybe you're not improving the way, and you get discharged, and now you have to go home and you live alone and you need to go to the doctors. How are you going to pay for some of those things? And that's where that recovery care comes in. We talk about a lot. No one doesn't home care, that's not covered. As well as some new products coming out to help with cost of maybe not just skilled, but with assisted living. Things are very fluent right now, changing. So yeah, when it comes to hospital stays, skilled nursing, there are a lot of exposure gaps. The first 20 days, yes, they are covered through Medicare. But after day 20, there could be a copay. And after day 100, well, there's no insurance after day 100. That's completely on you. So maybe you are there for 3 months and now you're still not well and you still have to go home and recover. Wouldn't it be great that you had insurance to help you when you're home? So those are the things that we're really educating everyone on, not just this particular moment. Hey, I give you insurance today, but my thing is always, well, what if something acute should happen in your life? What's your plan? And then the conversation changes. And it's like, well, what do you mean? I'm like, yeah, well, if this happens, how are you going to pay for it? And we're also talking about retirement assets for people. Do you really want to use your retirement assets to help pay for your care? Your retirement assets are for your retirement to enjoy, hopefully not to have to pay for your care. And if we could offer you an insurance product to help pay for that care and protect your retirement assets, I don't know. I think that's a pretty win-win situation for you. So Absolutely. Those are the conversations we're having with people now.
So Stephen, when do the gaps start to show up?
When do the gaps start to show up? Yeah. Well, here's an example on a Medicare Advantage plan, for example. The day 0, 1 through 20 are covered. On some Medicare Advantage plans, after the 20th day, there's a per diem, $217 or $219 a day out of your pocket. So there's your first gap. Okay. That's up until your out-of-pocket max. So let's use round numbers. Your out-of-pocket max is $10,000. Well, again, I'll come back to you. If you go to the hospital, have to stay in skilled longer, how is that number going to impact your budget? And 9 out of 10 times, someone's going to say to me, it's going to impact my budget, or it won't really impact me. But then I'll say, well, do you really want to use your retirement assets to pay for that? And the answer is no. So that's part of the gap right there we talk about. That's very important. People don't realize those things. No one takes the time to break them down, I should say. A lot of agents don't. I do.
And why is this so important, especially for retirees?
I'm sorry, I didn't hear your question, Steve.
Important because you deal with a lot of people, retired people.
Mm-hmm. Yeah, I mean, again, protection of assets.
People why is so important.
Yeah, I mean, we want to, our goal is to help, help you have the best health insurance you possibly can, as well as, like we talk about your retirement assets. Your goal is to protect your assets. We don't want to have to see you use them to pay for your care. If there's products out there that we can educate you on to help protect you, that's very, very important. I mean, you've worked hard to save your money. And I see this every day right now with some, people that have not planned properly. Now, we just had a family member at the house here talking about this morning how her mother now is transitioning to assisted living, and all of the out-of-pocket expenditures that are happening here in New Jersey for this family. And had they known about things sooner with me, they would not be in this situation. But it happens because they didn't know. People just don't understand or not, educated enough. And that's our goal, to continue to educate everybody on this.
Stephen, what do you look at when you're putting together a plan for someone? I'm sure one of the things is if they're on a fixed income.
Yeah, and that's a great question, and it's funny because I've changed my client needs analysis. And besides the introduction, one of the very first things I ask every senior or family now is, what would you like to get out of this appointment? What's important to you? This way it helps me understand what they're feeling right now. What are they concerned about? Are they concerned about their premiums, making the co-payments? If they're on a fixed income, how am I going to pay for things? So I found by asking that question right in the beginning, it really changes the complexity of our conversation. What's important to you? And that really, people are like, oh, wow, I never thought about it like that. And like, yeah, let's talk about what's important so we make sure we choose a plan that's going to best fit your needs, especially like you said, if you're on a low income, you're on a fixed income, how can we make sure we protect you against out-of-pocket costs and stuff like that? And make sure you're in the right plan, with your doctors are in the plan, your medications are being covered. Those are all the details that now need to be discussed.
I guess it's also important if they live alone.
Yeah, that's a big one. And that's and living alone, that is really, that's just really hard. When I work with a family, I understand that they're living alone, and want to make sure that that's really where I go, into detail about explaining to them the importance of having these recovery care or home care products, because they are home alone and they're on a fixed income. And if there's something out there that will help them with their care, well, that's very important. And, again, we're making that positive difference in someone's life.
We just got our first text from Boca Raton. That's right. That's in my backyard. They want in everybody. We're getting 3 or 4. We've got 5 people asking the same question. When you go on Medicare, what about pre-condition?
Pre-existing conditions. That's a great question. With respect to pre-existing conditions, that's why timing is so important when enrolling in Medicare, especially during your, initial election period, deciding what plan you're going to enroll in. For example, if you're going to enroll in an original Medicare supplemental plan during that guaranteed issue period, where there are no questions being asked against any pre-existing conditions. So it's very important. The timing of everything is looked at. I can't stress enough that when you're turning 65, how important it is to make sure we have this conversation to discuss pre-existing conditions and enrolling properly. Because as time goes on and health conditions and your health does change, which it will, and there are some pre-existing conditions, that's going to affect what type of plan we're looking at. Especially now, if someone's going from a Medicare Advantage plan, they want to go back to original Medicare, they're going to have to go through underwriting for a Medicare supplemental plan, and they have pre-existing conditions. So they may not be approved, or they may be rated and may cost more, and it may not be an advantage for them. So those are always things that we talk about, pre-existing conditions, as well as with some of the new products we're coming out with. There are some underwriting questions regarding that stuff, but we constantly educate about that.
How do you ever stay up with it? It just seems like it's changing. I went and had glasses 2 years ago, and it was completely covered, everything, no money out of pocket. I went 3 weeks ago for the exact same, going to an optometrist, getting glasses. It was $130 this time.
It's funny you should say that, because Judith just said to me the other night, she was sitting here, and after the conversation, she says, "How do you know all this?" And I said,
Yes.
those mornings when I'm at 5:30 sitting here reading stuff, or at 8, 9 o'clock at night studying stuff, like when I want to be watching Netflix, but rather I'm reading Medicare information, that's how I stay ahead of everything. It's constant. I have to self-educate myself every single day. And that's what I do. I always make sure I take time every day, a couple hours, just to self-educate myself, because it's so fluent. Everything is constantly changing. So yeah, it's a great question.
Stephen, I just read the other day that the price, when we're on Medicare, the price we pay for subscriptions is already negotiated at the lowest rate. Is it as low as what the president has negotiated?
That's a great question. I
heard it's really low.
It's low.
Medicare is negotiated.
Yeah, it is definitely low what they've negotiated. I've been on the new website. It's still, I know his new website really.
Trump RX.
Yeah. I don't really understand all of it yet. I know it leads you to platforms to look at coupons and savings, but I can honestly say I have not done enough knowledge yet to really fully understand that site. But that is the overall goal, is to, the cost of medications are so expensive for some situations. I had a gentleman yesterday in Minnesota. It was a very eye-opening experience to go through his medications with him. Yet he was on 19 different medications. So it was a lot of work. Yeah, he was on 19 different medications. So that was a very time-consuming conversation, but at least we were able to go down and drill through everything and understand, what was going to work best for him.
Final question. We got two of these. One from Charlotte, the other one from can't read the name, but they want to know, they're almost eligible for Medicare. How far out should they contact you?
6 months.
Okay.
6 months
From
prior.
their birthday.
Yep, 6 months prior to their birthday, they should be reaching out to us. 6 months prior, they should be reaching out to us so that we begin the process of, explaining to them original Medicare versus Medicare Advantage, prescription drug plans, Medicare supplemental plans, as well as some of the other, recovery care, home care, cancer insurance products that we have. And we actually just made a big change, Steve, on our website. If someone goes to the website and they click on the word Medicare, right below that is our new Medicare 101 webinar. So someone can just go to our website. They can just go to the website, click on the word Medicare. As soon as the very first drop down, Medicare Simplified, it's called. Click on that, and that'll populate our Medicare 101 webinar. We just made that change last night, matter of fact.
I am so glad you're my new agent. Tell people again how they can reach you, for those who are listening on radio, Stephen.
Sure. Again, so they can go to the website, which is www.frommeis.com. And there's a contact form on that website. They can fill that out. It'll come directly to me, and I will give them a call. As I also mentioned, on there is our new webinar, Medicare 101 webinar. And starting Monday, there'll be a link to the digital book. There'll be a link that someone could just click on that and get a copy of our digital book we just wrote, as well as they can call us on 877-801-4440. And always, we appreciate the opportunity to help everybody.
Stephen will be back again with us next month. Stephen, thank you so much. Just a world of information. We're so lucky to have you. We'll see you again next month.
Always appreciate the opportunity. Thank you very much. You guys have a great day.
God bless, my friend. That's Stephen Fromm. Folks, I'm telling you, if you're getting ready to go on Medicare, you're on Medicare, I'm telling you, you need to contact Stephen. Hey, that's going to do it for us today. We'll be back in with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.